20 years ago, Surgeon General C. Everett Koop said, "The poorest in our nation have dramatically better health and health support than millionaires and kings of 100 years ago. While healthcare quality and access have gone up, so has the cost." Learn why here on Healthy Dialogues. It's true, 100 years ago, people like Cornelius Vanderbilt II, who tripled the already enormous Vanderbilt fortune, couldn't keep his 22-year-old son from dying of typhoid fever, something that could easily be cured today. Even 50 years ago, a third of the people in one of today's sold-out baseball stadiums would have been too sick, or too dead, to go to the game. You don't have to be a Surgeon General to know that the quality of healthcare has improved immeasurably since that time. It's worth keeping this history in mind as we examine the question of why healthcare has become so expensive. Healthcare spending in the United States consumes nearly 18% of the gross domestic product. In 2014, the nation spent over $3.5 trillion on healthcare. If present trends continue, it will be $5 trillion by 2020. The reasons for these ballooning costs in healthcare are numerous and complex. They can, however, be broken down into 5 general categories. Number 1, and the most obvious, general inflation. The cost of healthcare has risen in part because the cost of everything has risen. For example, in 1992, a basic Toyota Camry cost $11,500. Today, the same basic model costs $23,000. That's a 100% increase in 23 years. Number 2, technology. In medicine, technology has advanced in miraculous ways, but progress is very expensive. For instance, ventricular assist devices, partial artificial hearts, can resolve otherwise untreatable heart failure, but just one of them can cost hundreds of thousands of dollars to create an implant. Unlike most industries, where technology often reduces cost, it frequently adds cost in healthcare, mostly because of the additional highly trained staff the new technology requires. Number 3, unnecessary utilization. Misaligned incentives drive higher utilization. When someone else is paying for the bulk of the cost for a service we use, we tend to use these services more and more capriciously. Up until 1965, people generally paid personally for medical service. It put families at greater risk if there was a medical emergency, but it really made people think about the cost of the care they received. Today, this financial reality is reduced or even eliminated, leading many of us to demand services which may add no value or even be harmful. The current relationship between doctors, insurance companies, and patients makes accountability for costs, quality, and utilization difficult to rationalize. Too often, it leads to a cycle of inefficiency and waste. Number 4, cost shifting. Despite our country's continued efforts, not everyone carries health insurance. That doesn't mean they're not getting care, it just means they're usually not paying for it directly. Additionally, both Medicare and Medicaid pay physicians and hospitals less than the actual cost of care, leaving a disproportionate burden on the private sector, which ultimately devolves to private payers, usually employers. Number 5, which brings us back to the Vanderbilts and the Berwins, the cost of success. Current generations are, ungraciously, living into their 80s and 90s, something that was distinctly unusual when Medicare was created in 1965. At that point in time, if you made it to age 65, you were expected to live to about age 72. Now, if you reach that same milestone, you'll likely live well into your 80s, 3 times as long after the age of 65. And of course, these are the years when we spend the most on healthcare. On average, the longer we live, the more we spend. As the costs of healthcare and health insurance rise to compensate for the added burden of the uninsured, more people become unable to pay into the system, and the problem continues to get worse. These rising healthcare costs are one of the biggest problems that face America. After all, it doesn't matter how good healthcare is if people can't afford it. We have to keep costs sustainable while maintaining the healthcare quality that's immeasurably improved our lives. At Intermountain Healthcare, we're implementing solutions to this cost conundrum, including, first, engaging patients in their own care, giving them the information they need to make decisions as wisely as physicians do for their own care. Second, operating as a team to find the best ways to keep people healthy and to get them back to health when they're sick. Third, improving clinical quality, and counterintuitive as it sounds, Improving quality tends to reduce cost. And fourth, sharing quality service and cost data openly. It will take new ideas and ongoing conversation to provide consistently better health care at lower and more sustainable costs. And while this will take time, the results will be well worth it. For more videos on transforming healthcare, please subscribe to the Healthy Dialogues YouTube channel.